Welcome back to The Explainer. Today, we're diving into something called postural orthostatic tachycardia syndrome, or POTS for short. It's a condition that's getting a lot more attention lately, but honestly, it's still widely misunderstood.
Okay, let me ask you this. Have you ever just stood up and bam, you feel dizzy, weak, or like your heart is absolutely pounding out of your chest for no reason at all? If you're nodding along thinking, yeah, that's me, then stick around. We're going to shed some light on what might be going on.
The thing that makes POTS so tricky right from the start is its symptoms. We're not talking about just one thing here. It's this whole collection of issues: palpitations, extreme fatigue, that really annoying brain fog. And because the symptoms are all over the place, it's so easy for doctors to miss it, or worse, misdiagnose it.
So, what are we actually talking about here? What is POTS? Well, officially, it's a disorder of your autonomic nervous system. That's the part of your body on autopilot, the part that handles your breathing, your heart rate, all the stuff you don't have to think about. And POTS is basically a form of what's called orthostatic intolerance, which is a fancy way of saying your body just really struggles to adapt when you stand up. And this is a really important point. POTS isn't just about your heart beating fast. It's a systemic issue, meaning it affects your whole body. We're talking about widespread dysfunction. It messes with your blood flow, your blood pressure control, even the tiniest little blood vessels. And that's why the symptoms can pop up literally from head to toe, everything from headaches to seeing blood actually pool in your legs.
Okay, so if this is what it is, how do you even get a diagnosis? This is a huge deal because for so many people, it's a long, frustrating search for an answer. But thankfully, it often starts with one key clinical test. And that test is called the active stand test. It's really the cornerstone of a POTS diagnosis. What's amazing is that it's a pretty simple procedure, something that can be done right in a doctor's office. Its whole purpose is to measure exactly how your body, specifically your heart and blood pressure, reacts to the simple act of standing up and fighting gravity.
So here's how it works, and it's pretty straightforward. First, you'll lie down for a few minutes so they can get your baseline heart rate and blood pressure. Then you stand up, and you just have to stay as still as you can for about 10 minutes. All the while, they're monitoring you, checking your stats every minute. And this is key. They're also documenting every single symptom you feel, whether it's dizziness, shakiness, or nausea.
So what are they actually looking for? This is the crucial diagnostic part. For adults, they're looking for your heart rate to jump up by at least 30 beats per minute and stay up. For teens, that number is 40 beats per minute, and this has to happen within 10 minutes of standing. But here's the other really important piece. This all happens without a major drop in your blood pressure. That's what separates it from other conditions. All right, so once you have that diagnosis, the whole game changes. The focus shifts from what's wrong with me to, okay, how do I manage this? Living with POTS is really all about building your own personal toolkit of strategies to get those symptoms under control and, get your life back. And I want to be clear, there's no single magic pill here. Management is a multi-pronged attack. It's holistic. It's going to involve a combination of lifestyle changes, maybe some medication, and a really tailored exercise plan. It's about hitting it from all sides. So step one is always the foundation, lifestyle changes. This is your first line of defense. We're talking about things like seriously upping your water intake, like up to 3 liters a day, and also increasing your salt. Now that might sound weird, but salt helps your body hold onto that water, which boosts your blood volume. Another big one is wearing firm waist-high compression garments. They literally help squeeze the blood back up from your legs so it doesn't just pull down there when you stand up. Now, for a lot of people, lifestyle tweaks just aren't enough, and that's totally okay. That's where step 2, medication, comes into the picture. And there are a few different ways these drugs can work. Some, like midodrine, actually tighten up your blood vessels to help push blood back to your heart. Others, like fludrocortisone, help your body retain more salt and water. And then you have drugs like ivabradine that just focus on bringing that heart rate down without messing with your blood pressure. And that brings us to the third piece of the puzzle, exercise. Now, this can sound completely backward, right? My heart raises when I stand, so you want me to exercise? But the approach here is very, very specific. It's not about going out and running a marathon. You often start with things you can do lying down or sitting. Think recumbent bikes, rowing, or swimming. The whole idea is to slowly, carefully recondition your body so it can handle being upright without freaking out. So we've talked about the what's and the how of diagnosis and management, but it's just as important to talk about the human side of this, the actual journey for patients, which is filled with challenges, but also a lot of hope. Take a look at this number, 6.7
7 years. That is just staggering. In Australia, that's the average time it takes for someone with POTS to finally get the right diagnosis. Can you just imagine living with these debilitating symptoms day in and day out for almost 7 years with no one able to tell you why?
And think about what those years are like. So many patients are told it's just anxiety or that it's all in their head. So when they finally get that diagnosis, the validation, it's huge. The source material puts it perfectly. Patients describe this simple act of finally being believed as absolutely life-changing. But the complexity doesn't even stop there. POTS rarely travels alone. It often shows up alongside other complex conditions, things like Ehlers-Danlos syndrome, chronic fatigue syndrome, or mast cell activation syndrome. This overlap just makes everything more complicated. It means you don't just need one doctor, you need a whole team of specialists who can work together. And let's be honest, that can be incredibly hard to find.
So, why is this so important for us to talk about right now? Well, it's because we're seeing a massive surge in POTS cases, and it's being linked to long COVID. The pandemic has basically thrown a giant spotlight on this condition that used to be pretty obscure. And that means that getting the word out, educating both patients and doctors, is more urgent than it has ever been.
Look, the path forward is definitely challenging, but there is so much reason for hope. All this new awareness is driving more research and better education. And that leaves us with a really exciting question to think about. With our understanding of POTS growing every single day, what kind of breakthroughs in treatment and care are waiting for patients just around the corner?